and welcome all our viewers once again in the Dams studio. It is a wonderful feeling to talk to the toppers every time. Today I have the pleasure of welcoming Dr. Rahul Aitaan, ranked 20 in the Army Dental Corps 2016 exam. Wonderful result. We are very happy to have you here, Dr. Rahul. Just share with us, how are you feeling?
Yes, sir. I'm feeling very grateful to the God. I'm feeling really happy to be here, to be into the Army Dental Corps, and it's being an honor for me to be here. So thank you so much.
Well, thank you very much for coming today, I would say. And as to my information, only the selected people, only a very few of the dentists would enter the Army Dental Corps. But before we go into the normal questions with important information being shared by you, tell us something about yourself.
See, I am Dr. Rahul Aitaan, and I basically belong to Sri Amritsar, which is located in Punjab, and I have done my graduation from Shri Guru Ramdas Institute of Dental Sciences, Sri Amritsar, and I have been associated with DAMS since April-May 2015, and that's it.
You were a regular course student, if I'm not wrong?
Yes, I have joined a regular classroom project with the DAMS.
Oh, that's very nice to know. One very important thing that first of all comes to our minds, Dr. Rahul, is that how did you prepare for a tough exam like this, and how did you manage your time? Because when anybody is preparing for a postgraduate dental entrance exam, time is the biggest constraint. So how did you manage and how did you prepare?
Yes, I just follow normal strategy. I didn't go for 15 to 16 hour study, and I just follow 6 to 8 hour study schedule per day, and I just was little bit of focused and dedicated towards my goal, and that's it. You just need to be seated for 6 to 8 hours a day, and you just will have to make your mind that you want to do this, and definitely you will get you. And being associated with DAMS, I don't think if I were not in DAMS, I would be able to get any kind of rank, and I would not be able to sit in any kind of this all India examination, whether or a state examiner or any Punjab PPSC exam. And in all these exams, I think I have done a better only because of DAMS.
That's very nice to know, and what I can gather here is the consistency and remaining focused towards your target has helped you. Well, many congratulations on your wonderful result that I've already told my viewers, ranked 20 in the Army Dental Corps exam 2016.
Thank you so much.
Dr. Rahul, I ask you a direct question here, that how was DAMS quest was useful in your preparation?
Yeah, as I have told you earlier, that DAMS Quest is that kind of platform for each and every aspirant, whether he is in Amritsar, whether he is in Delhi, he is in Ahmedabad, from all over India. He can connect with each and every faculty of DAMS, whether it is a medical faculty and dental faculty, and each and every aspirant who is having little bit of any doubt about each and every question, he can easily doubt his questions through posting his question in Facebook, and that is called a DAMS Quest Club. So it is very efficient and very useful for an aspirant to crack any kind of exam.
So, well, any further comments on the DAMS Dental Cloud that is available to the students?
Yes. DAMS Cloud is very benefit in the way that the previous conversation with the students as well as with the teachers, they can upload on the DAMS Cloud. So many of the fellow aspirants, they can be motivated, they can be further collect more information about the subjects, about the previous exams. So DAMS Cloud is very much important.
Well, you have already mentioned about the DAMS MDS Quest Club on the Facebook.
Yes.
Can you put some more light that how was it, can you be a little more elaborate on the help that you got by connecting on the MDS Quest Club?
So see, MDS Quest Club is not just a club to watch each and every aspirants who is posting questions, who is posting his doubts. So we can interact with each and every aspirant as well as teacher. The more interaction with aspirants, so we can assess ourselves that where we are standing, which kind of questions where we are lacking and where other people are doing good. So we can assess our performances as well.
Are there some confusing questions or controversial questions in dental exam also?
Yeah, obviously there is so much huge controversial questions, but I don't think that the aspirant should waste his time clearing in his this kind of controversial questions. So because the controversial question might come in not a good quantity, might be one single or two or more than three. So I suggest the fellow aspirants to just focus on new techniques that new examination are asking. So I don't think, but the DAMS Quest Club, here we can clear all these controversial questions. So this is very helpful platform for the aspirants.
Well, that's very nice to know, and these are very valuable inputs for all the aspirants. And let me remind my viewers once again, I'm talking to Dr. Rahul Aitaan, Rank 20, Army Dental Corps Exam 2016. Dr. Rahul, would you mind sharing with us, your inputs regarding the CBT that is conducted by DAMS MDS Quest?
The CBT is very useful because in CBT, each and every aspirant who is going to appear in the AIPG or any state entrance exam. So CBT is basically focused on AIPG exam. So every aspirant gets very much familiar about the pattern, very much familiar about the kind of questions that new examination patterns have been asking. So CBT is a wonderful platform. I think each and every aspirant should give should give CBT that has been conducted by DAMS since I think last 2 years.
Thank you very much for your information here. And as we all know that DAMS is the only institute which has introduced from this year a DVT session for MDS aspirants. Did you take that DVT session?
Yes, I have taken.
How did you find it?
The DVT session is very much more important as according to recent scenarios in AIMS 2000 May 2016, then November 2016. There were so many questions who were in image based. So in this DVT session, so many students were very familiar about these image based questions. So DVT is very much useful.
So you think that it gave you that extra edge?
Yeah, obviously.
Well, that's very nice to know. Let me also share a fact here with our listeners, with our viewers here, that DAMS is the only institute which provides for the comprehensive study material for MDS aspirants. Can I have your opinion on our study material, Dr.?
Yes. The study material is awesome, just awesome. Too good study material, as I didn't go for the bulkier books. I just get up with these small booklets that provided by the DAMS, and just nothing else you want to read. No bulkier books you want to read.
They are sufficient and
yes. More than sufficient.
That's very nice of you. We also conduct various dental paper discussions with respect to AIMS and AIPG dental medical entrance exam. So did you appear or did you take any of these discussions?
Yeah.
How useful were they?
Yes. The faculty in DAMS, I don't think the faculty the DAMS is providing any other institution can provide, whether it is a medical faculty or dental faculty. And I have joined around 4 to 5 discussions with the faculty, and I just can say that the faculty is very much important for a student to get any kind of a rank. But so the faculty that DAMS is providing, no other institution can provide.
Those are really kind words by Dr. Rahul here.
Yes.
We have been talking a lot about various aspects of preparation and various things that were provided by the DAMS MDS Quest. Let us talk on the evaluation system. With that, I refer to the online test, to the subject-wise tests, and the grand test, mock test, etc., which is available to the students who are preparing for the MDS. What is your call? What is your opinion on such evaluation systems with the various tests, as we have mentioned earlier?
Being an aspirant, for every aspirant, the test series is a very valuable platform to assess his performance and assess his performance amongst all other candidates. So DAMS test series has a very great pattern and test that are grand test and subject-wise test. So I don't think any aspirant should go for any other test series other than DAMS. So I recommend each and every student to associate it with the DAMS test series as well.
That's very nice to know. And let me remind my viewers once again that I'm talking to Dr. Rahul Aitaan here, Rank 20 Army Dental Corps Exam 2016. Well, before we wind up this conversation, a few more questions for you, Dr. Rahul. Which faculties did influence you most in DAMS MDS?
If I were to name anyone, so it will be like disrespecting the other faculty. So I won't name any faculty, but I would name the DAMS as an institution. So DAMS as an institution is more than anything for an aspirant.
That's very kind of you, and that's very diplomatically answered. Anyways, thank you very much. And before we wind up this conversation, any message to your juniors?
Yeah, I have a very small and strong message for the juniors, that if you want to achieve any kind of goal, you will have to be dedicated. You will have to be mentally prepared that what I am going through and what will be I going through. So if you want to achieve any goal, you will have to sit and study for 6 to 8 hours minimum, and you will have to just be dedicated and just be sure and be confident that you can get everything. And एक one more मैसेज मैं अपने पंजाब ਦੇ ਵਿਊਅਰਸ ਵਾਸਤੇ ਦੇਣਾ ਚਾਹੂੰਗਾ ਕਿ ਜਿਹੜੇ ਖਾਸ ਕਰਕੇ ਮੇਰੇ SGRD ਦੇ ਸਟੂਡੈਂਟਸ ਨੇ, ਮੇਰੇ ਜੂਨੀਅਰਸ ਨੇ, ਉਹਨਾਂ ਵਾਸਤੇ ਸਿਰਫ ਇੰਨਾ ਕੁ ਮੈਸੇਜ ਹੈ ਕਿ ਤੁਸੀਂ ਵੱਧ ਤੋਂ ਵੱਧ ਮਿਹਨਤ ਕਰੋ ਤੇ ਆਪਣੇ SGRD ਕਾਲਜ ਦਾ ਵੀ ਨਾਮ ਥੋੜਾ ਜਿਹਾ ਉੱਪਰ ਲੈ ਕੇ ਆਓ, ਤਾਂ ਕਿ ਸਾਰੇ ਇੰਡੀਆ 'ਚ ਪਤਾ ਲੱਗੇ ਕਿ SGRD ਦੇ ਸਟੂਡੈਂਟਸ ਵੀ, ਆਪਣੇ ਪੰਜਾਬ ਦੇ ਸਟੂਡੈਂਟਸ ਵੀ ਕਿਸੇ ਤੋਂ ਘੱਟ ਨਹੀਂ ਗੇ. ਸੋ
Do you recommend DAMS MDS Quest to them?
yes, ਮੈਂ ਆਪਣੇ ਪੰਜਾਬ ਦੇ ਫੈਲੋ ਸਟੂਡੈਂਟਸ ਨੂੰ ਜਾਂ ਆਪਣੇ ਜੂਨੀਅਰਸ ਨੂੰ ਡੈਮਸ ਕੁਐਸਟ ਕਲੱਬ, ਡੈਮਸ ਟੈਸਟ ਸੀਰੀਜ਼, ਡੈਮਸ ਕਲਾਸਰੂਮ ਪ੍ਰੋਜੈਕਟ ਸਭ ਕੁਝ ਰੈਫਰ ਕਰਦਾ ਹੈ ਕਿ ਉਹ ਜਿੰਨਾ ਮੈਕਸਿਮਮ ਕੋਸ਼ਿਸ਼ ਹੁੰਦੀ ਹੈ ਕਿ ਡੈਮਸ ਨਾਲ ਐਸੋਸੀਏਟ ਕਰਨ, ਤੇ that will be benefit.
Well, thank you very much here. We wish you all the best in life. Dr. Rahul Aitaan here, Rank 20 Army Dental Corps Exam 2016. Wish you all the best in life.
Thank you so much.